Welcome to Fuzzybutts and Friends. Well, as much as it drives Fuzzybutts all over this place absolutely crazy when they hear me say it, I am the host of the show, your big dog, Luke Robinson, and we're happy, just awfully glad, happy to have back with us again this week our co-host and our co-producer, or junior co-producer, I think. I kind of like that better, Ginger. She's the executive director of the Puppy Up Foundation, Ginger Morgan. Ginger, how are you?
I'm well, Luke. How are you? I'm excited about our topic today.
I am too. As you know, as you get older, which your big dog is doing, unfortunately, it happens to every one of us, you become a lot more conscious of your teeth and dental care. And if you don't, that can become problematic in so many different ways. And so we're happy to have with us this episode to speak at length. She's an expert on so many aspects of the topic. It's Dr. Stephanie Lynne Goldschimt with UC Davis. Dr. Goldschimt, how are you?
I'm doing well. Thank you guys for having me.
Thank you for being here and welcome to Fuzzybutts and Friends. All right, we like to start off the show with a little bit of fun. First of all, do you have Fuzzybutts?
I do not have, you mean a personal fuzzy butt, a dog?
Yeah.
I do, and he's actually here. I'll show you.
Excellent. We love to see Fuzzybutts on Fuzzybutts and Friends. We don't know. Oh, look
Yep.
at that, handsome.
So he came to work today.
What's his name?
Cute.
This is Duke.
Duke, he's a handsome fella. Yeah, excellent. Thank you very much for that. All right, so tell us, Dr. Goldschimt, about your origin story. How did you get to the point professionally that you're at now?
Sure. So I'm originally from New York. After New York, I did undergrad at University of Wisconsin-Madison, and then I did vet school at University of Edinburgh in Scotland. Following that, I did a rotating internship back in New York and my residency back at UW Wisconsin. So I got really inspired about dental health kind of during vet school, later in my vet school training. So I did a 3-year residency in dentistry oral surgery. After that, I went on to teach at University of Minnesota, there for about 5 years, and then transitioned to the position here.
Well, that's a tremendous CV, by the way. That's so much to it, and you bounced around a lot too. And
I did.
But to some very neat, interesting areas. So I'm sure your experience is very diverse. But how did you become? Let's back it up a little bit. And how did you become a veterinarian in the first place? What passion led you to the profession?
Yeah, so I've always wanted to be a vet. So I was one of those kids that wanted to be a vet and actually did it. So I love animals. And I especially like fields, dentistry kind of falls under the surgery umbrella. There is a problem and we can fix it, which is really rewarding. And especially in older dogs, like we'll have clients say they're like a puppy again. You can just see it's really marked difference when we're able to treat those issues.
Excellent. And we love passionate people that have a passion at the very beginning and stick with it. It's rare indeed. Did you have a lot of Fuzzybutts growing up?
I did, but only one at a time. Because I grew up in Manhattan, so there's not a lot of room for a house.
And I'm guessing they probably were the size of Duke, because Manhattan also does not like big dogs, as I found out.
Well, yes, but we actually did have a very big dog. We had a Bernese Mountain Dog.
A Bernie.
Wow.
Excellent. We love Bernies, Berners, absolutely. Well, let's just kind of start with the basics, I guess. Let's talk about, because we have a lot to cover and you're very specialized in what you do, but let's talk about just basically dental care in dogs. Just run our audience through that.
Yeah, so kind of, I think a really big thing that people forget, our dogs are very similar to us. So when we think about kind of how we get gum disease, dogs are actually almost a perfect model for humans. So what I normally tell people is think about like if you didn't brush your teeth for 8 years, what that would look like, right? So we sometimes forget the importance of just preventative care in our dogs. So we actually would recommend from as young as possible, starting with daily dental care. The ideal, the gold standard would be brushing the teeth, but obviously, in a lot of times that's impossible. So we recommend at least other things to help decrease plaque and calculus, like dental diets or dental treats. But on top of that, just like we brush twice a day and we still go to the dentist, we'd still recommend getting professional cleanings and evaluations under anesthesia. So normally we recommend those about once a year. And every dog is going to be a little bit different. So dogs like Duke, unfortunately, are a little more prone to severe gum disease. So sometimes that needs to be a little tighter, like 9 months or so. And some dogs, like big labs that are chewing all the time and naturally cleaning the teeth, can go longer between. So we normally would say, you know, start with that yearly cycle, and then your vet can work with you about what that looks like. A question, I'll just touch on it now. People always ask about anesthesia-free cleanings. Fortunately, those are not great options because we can't clean under the gum line. And that's where most of that infection is that causes problems. So it's really important to kind of think about prevention in our pets. And we normally recommend the first cleaning or evaluation around 2.
That's all great, excellent information there. I was fascinated, Dr. Goldschimt, when I was doing due diligence for this episode, that I'm not sure how much you know about the Puppy Up Foundation, but our work is comparative oncology. We look at the links between cancer and pets and people, because as you know, the dogs are a great model. And I was fascinated and excited to learn that everyone is talking about comparative odontology, and that's great. So, and you just spoke about that just a moment ago, of that dogs that basically their dental structure is very comparable to ours, right?
Yeah, near identical, really. So when we think about kind of the way that we have teeth, that we have baby teeth and adult teeth, they're very similar. And the way that periodontal disease, which we colloquially will call gum disease, how that progresses is essentially identical in dogs. So there have been a lot of actually dental health studies done in dogs to kind of guide what we do in humans. But when it comes to gum disease, we actually know a lot more in humans. So we can actually take some of that information and bring it back to dogs, about thinking about preventative care, plaque control, and how that impacts bone loss and gingivitis.
If it's that comparable to humans, though, it seems to me that getting dental care once a year that's not a lot of dental care. So prevention, like you were mentioning a moment ago, becomes paramount, of paramount importance. So what can you just kind of go through a list of 5 to maybe 5, as many as you can think of, things that pet parents can do, products that they can purchase that perform as they should to help prevent these infections that require the deep gum cleaning, as you were speaking of?
Yeah, so the best, as I mentioned, is brushing. That's always going to be the best, because it's the best way to kind of remove that plaque biofilm. And normally what I would say is just go buy a pediatric soft bristle toothbrush, just like a children's toothbrush, and they can use water or doggy toothpaste. There's actually no evidence that the toothpaste is better than the brushing alone. It's very rare for dogs to get cavities, so it's really more mechanically disrupting the plaque. However, I mean, in reality, brushing can be really difficult. So what I'd recommend next under that would be considering a dental diet. Dental diets that I really enjoy or I think are effective are Hill's TD, that is prescription. There's also a Science Diet brand that is good. On the website, the Veterinary Oral Health Council, that's through the ABDC, that looks at every diet or treat that has gone through a clinical trial. So it has been proven to work effectively. And I can put that link in the chat, so that your viewers can go onto that website. But I personally like Hill's TD. Other great options are dental treats. They should be given once daily though. So Tartar Shield is a great option, or that also makes a really nice chew. Greenies are good options. You know, the old formula used to get stuck in the throat. They've redone the formula, so we really haven't been seeing any of those problems.
Oh, that's good, because I've always been, like, years ago, I gave my dogs greenies, and then I heard all that, and I'm like, okay, I stopped. So I've always been leery of going back to them.
Yeah, so I
Good
definitely
to
think
know.
they're worth a try. Yeah. And any treat for the first time when you're with your pet, I would sit with your pet, right? Make sure they're tolerating it. They're not, you know, gagging or taking too big of bites. Kind of lower on the recommendation scale would be things that don't mechanically disrupt the plaque. So things like rinses, water additives, or food additives are okay, but not as good. So normally I focus on more that mechanical action, and even encouraging your dog to play and chew on things that are soft enough that they're not going to damage the tooth are also really great cleaning options.
Yeah, I've got 2 Pyrenees that absolutely do not play with anything except food. And so I wish, and you know, it seems to me that dogs are getting smarter, and we're able to train them to do a lot more complicated, complex things than 10 years ago, how close are we to being able just to teach them to gargle? And then that way we don't have to brush their teeth.
I mean, that would be great. When you
Or to
do
brush
it
their
with your
own
dog,
teeth.
you tell me how to do it. Yeah.
Because I have to say I'm a bad big dog when it comes to brushing my boys' teeth, and even my own to a certain extent. Tell us, Dr. Goldschimt, one of the questions I just came to the top of my head. You mentioned it ago about Duke. Are certain breeds more prone to dental disease?
Yeah, definitely. So we don't have a total like breed list, and when we look at genetically who's more predisposed, but in general, we see that smaller dogs that have more crowding in their mouths are much more prone to advanced periodontitis. So they might not have that much plaque you can see in the mouth, but when we go under anesthesia and we look for signs of attachment loss, we see it more readily than a large dog. So definitely those smaller dogs, we would recommend more aggressive home care and more frequent professional cleanings.
All right, so that's a pretty good preview of prevention, what you need to do to prevent bad things from happening. Now let's talk about when bad things tend to happen or actually happen, and it's an area of your expertise, canine oral surgery. When do dogs? When does it warrant it? And walk us through the whole process.
Yeah, so oral surgery kind of carries this really big umbrella. When we think about kind of what encompasses an oral surgery, one of the big things are extractions or pulling out a tooth. So when we have plaque on the teeth, plaque and calculus, essentially that's infection, and the body responds to that infection by trying to move away. So we get gum recession, but we also get bone recession. So the bone moves away. We get what we call deep pockets. And eventually the bone moves so far and far away that we lose attachment on the tooth, and the tooth can become mobile or get secondary problems like infection going into the surrounding bone, causing bone infection or abscesses. So in those cases, extraction of the tooth is normally what is recommended. That's why we really try to focus on prevention to prevent us from getting to that point. Other kind of things that fall under the area of oral surgery that aren't related to gum disease are things like jaw fractures, which usually are an accident, hit by car or a dog fight, or what my subspecialty is oral cancer. So, a cancer pops up and we'll surgically remove that cancer so we can hopefully have long-term remission.
Yeah, we'll get to the cancer here in a second. Obviously, that's a particular area of interest in this podcast. Or I kind of left another question that I had to back up just a little bit. So, are there any items that you absolutely do not recommend for dogs to chew on, to eat at all, put in their mouth?
That's a great point. So we don't want them to chew on anything that's harder than tooth material. So anything harder than tooth material, if they chew on too excitedly, can break the tooth. So a good rule of thumb is you should be able to indent your fingernail into anything. So like Kong material would be really great. The other way that I tell clients to kind of watch for things that are too hard is if you would feel comfortable hitting it against your own kneecap. So if you would hit it again, your own kneecap and pull forward, it's soft enough to give your dog. Unfortunately, there's a lot of marketing of toys and treats that are way too hard, and we see a lot of tooth fractures. And if a tooth is fractured, just like in a human, if it exposes the inside of that tooth, it's prone to infection. So it has to be treated with either a root canal procedure or surgical extraction. So pulling that tooth.
Do you put crowns on dogs?
We do. We do sometimes put crowns on dogs, but not for cosmesis, not so they look pretty, but often because we want to structurally protect that tooth from breaking more. Right. So in those cases, we actually do full metal crowns. Okay. So the most common would be police dogs. Yeah.
If and when, I've never actually had a dog that's cracked a tooth or required that or crown at all, but if and I ever do, can we get the gold and have like something etched in there cute?
Well, we can etch it, but we won't do gold because gold is really soft, but we can bedazzle it.
Bedazzle it. Yes. My three-legged Pyrenees, he loves to be bedazzled. In fact, he bedazzles me every day. All right. So what other, which we'll get to cancer here in a second, what other cases do you see? What are some of the noteworthy cases that you've run into that you think pet parents should be interested in and want to know about?
Yeah, I would say the two most common things we see and they should be watching for are that gum, periodontal disease and tooth fractures. Those are definitely by far what we see the most. Other cases that we see here is we'll see things like cleft palates or, openings of the two sides of the mouth, which probably you'll notice in really young patients. We also see signs of kind of inflammatory diseases like ulcers or mucosal diseases in the mouth. Those usually present with pain, especially in cats, but we'll see a lot of drooling, discomfort, not wanting to eat. And then trauma, so jaw fractures, we would treat here. And then, cancer is the other big one. So those are kind of our main categories would be, trauma, oral medicine, and oral oncology.
What?
And that's actually how we split it in our subspecialized within our service.
So
I
you
have to interject
please.
my story.
Yeah.
And I'll make it short. So years ago, I wound up adopting this little old dog. And the first night I had him home, he crawled up. I put him in the bed with me. He crawled up here, and all night he's going, and I could barely sleep. And so I named him Grandpa Stinky Breath, and it stayed with him, Grandpa for short. But I don't think he'd ever had his teeth cleaned. My vet guessed he was probably about 12. And I took him every 3 or 4 months to get his teeth cleaned. And finally, probably after 3 times, his entire personality changed. He was ready to go. He was up. He was running. He was telling the 90-pound lab what to do, and he weighed a total of 15 pounds. And it was amazing just how the dental care, and probably regular decent food, but I think it had to do more with the dental care than anything else, that just made him feel better and kind of brought, like you said earlier, the puppy back out in him. But Grandpa was Grandpa Stinky Breath all the time. He was old, and I got laughed at, when the vets outside the door, his name they just put Grandpa on it. You could hear them saying Grandpa, and then they'd walk in. I said, the rest of that is Stinky Breath.
I love it.
Well, let's hope that nobody ever gives me that nickname. That would be bad. But I love it. I love it. I never met him, but it's such a perfect name and perfect visual. Did you say, going back to something I think you said a second ago, half your cases or the extractions, the fractures, and then half the cases you see are cancer? Is that what you said?
Not fully cancer, but I would say half are these more common cases, the fractures and periodontal disease, and then the rest are definitely more specialized. So things like looking at, cleft repairs or these really severe oral medicine cases or cancer. The way we split it there are 3 faculty here at UC Davis, and the way we actually split our service is thinking about oral medicine. So like inflammation in the mouth, periodontal disease, and then trauma, and then cancer. So we all kind of have a little slice of the pie where we kind of focus our efforts on, especially our research efforts.
Excellent. All right, let's get to cancer now. So tell us all the different types of cancers that can affect the mouth, please.
Yeah, so if we're talking about dogs, the 3 most common cancers we would see would be oral malignant melanoma, oral squamous cell carcinoma, and oral fibrosarcoma. You can actually also see a bunch of what we call odontogenic tumors. So these are only tumors we see in the mouth because they come from tooth remnants. This category is actually a very quote unquote good category to have if you're going to have cancer, because they have no propensity to spread. They cannot metastasize, so can often be completely cured with surgical intervention.
Was that the 3rd type of cancer or all oral cancers?
No, so just odontogenic tumors.
Just odontogenic. Okay, because that kind of threw me, and you cut out there for a second. I think my web camera, my very expensive web camera, is on the fritz for some reason. So, all right, let's start off with, I think is the most common is oral melanoma. Is that correct?
Yeah, so oral malignant melanoma is the most common. And a big misconception is people think it needs to look pigmented, because they think melanoma, they think pigment, but we can also see an amelanotic type. So any kind of mass in the mouth does unfortunately have the capacity to be melanoma. Melanoma, unfortunately, can be extremely aggressive. So carries very locally invasive, so will eat into the underlying bone. The bigger issue is it carries a high metastasis rate, so a high likelihood to spread to the local lymph nodes in the lungs. However, the biggest thing that I really want pet owners to know, and is actually a big misconception, amongst a lot of the veterinary community as well, is if we catch these early enough, so we call it a T1, meaning it's less than 2 centimeters and it hasn't spread. actually we can often get a good survival time with surgery. So we can get, a median of about 2 years with those cases. But unfortunately with melanoma, as it gets larger, the survival time does decrease. And that's just because often it spreads. So even though we do everything to get rid of it locally, it's kind of already started to spread other places. Oh, go ahead. You look like you're about to ask a question.
Or yes, thank you. Are there any more areas inside the mouth that you more commonly see them? Where do you look, and how do you look to see hopefully before they get to the 2 centimeter mark?
Exactly. So there's no predilection area in the mouth for malignant melanomas. But the best time to look for them this is where like brushing is really helpful, right? It allows you to see those changes. So normally what I recommend is starting by kind of keeping the mouth shut and looking kind of on the outside area of the teeth and the cheeks and stuff, even if you're not brushing, just to get a quick look. And then ideally do a quick opening to look in the back of the mouth, and look for anything on the palate or on the inside of the teeth that looks abnormal. So kind of trying to get in a routine where you're looking in the mouth, every 2 weeks or something is going to be really helpful, especially as your pet gets older.
We
Okay.
do a monthly, send out a monthly like check for lumps and bumps. And one of the things is that don't forget looking in their mouth. So
Yeah.
I'm glad you explained exactly how to do it, because I've got like open them up, put your finger around.
Yeah. And a good, like, not all patients, not all dogs are great with you totally opening, but if you can almost just catch them when they yawn and just glance in, make sure nothing looks funny, that is helpful too. That's actually a lot of ways that people do pick up on it. Oh, they yawned and I saw something that shouldn't be there. I brought them in for further evaluation.
One of the other early warning signs of cancer that we have on our website, the 10 Ls, is loud odor. I couldn't figure out another way to use an L, I think, was what loud means odor, and that means any orifice, any area. So, but we know that with oral malignant melanoma, we know that could become awfully stinky. I'm assuming from the necrotic tissue.
Yeah.
But is it at that stage where it's a predominant odor, it's a foul odor? Is the cancer pretty advanced at that point?
Not necessarily. It just means that it got big enough to cut off its blood supply. And sometimes that happens faster than others, but definitely if there's an odor that's new or different, that's enough to say, hey, I don't know if this is just periodontal disease. I should get this checked out. But really one of the biggest things in melanoma, unfortunately, is the size. So we know that as for every centimeter bigger it gets, there's actually about a 30% increase in the hazard of death. So trying to be really proactive in catching these early is really impactful with melanoma specifically.
So tell our audience again that if it's caught before 2 centimeters, what's the average prognosis or outcome?
About 2 years with surgery.
Wow. So early screening, early catching is of extreme importance on that.
Yeah.
All right, you've inspired me to look in the orifice, the oral mouth of the gaping maw of my Pyrenees. So they love it when Poppy does things like clean the ears and grab the paws. So, but it's so important though, and it's of critical importance because, like you said, and I've always heard, I've never had experience, but I've spoken to so many veterinary oncologists around the country, is that oral melanoma, if you get it and you don't catch it early, it's just a bad one. It's a very bad one. And so you said if it does spread, it goes to the lymphs and to the lungs, correct?
Yeah, those are the most common areas. There are rare reports of it going to the belly, to like the liver or the spleen, but again, more unusual. Local draining lymph nodes and lungs are the most common. And unfortunately, it's not a very chemo-responsive tumor. So a lot of times we're limited on our ability to kind of manage it once it's systemically spread. Something we do have for melanoma that people always want to talk about is the vaccine. So there is a melanoma vaccine, which looks to kind of wake up the immune system to fight off the melanoma. Unfortunately, though, the data is very equivocal. So we don't know if it actually really helps survival. So I normally will tell people the only thing it's going to hurt is your pocketbook. We know that it's safe. So we have proven that it's safe. We just don't know if it actually makes a difference in survival. And a lot of centers are still actively collecting data on it.
Is that just because of a limited amount of data? Is that correct?
Yeah, and a kind of how they compared it. So in, some studies they compare to historical controls. Well, really what we need is a matched population to be compared.
Are the melanoma tumors, are they responsive to radiation?
They can be, yeah. So they are radiation responsive tumors. and they respond to what we call a hypofractionated protocol. So high doses, but not very many. So often only 4 to 5 times. So radiation can be a great option, especially
Is that like IRT?
Similar to IMRT.
Okay.
Not exactly the same, but a similar kind of thought. High doses, not as much.
Got it. All right. So it's good to know that so radiation would then succeed the surgical excision of the tumors. Is that correct?
Yeah. So normally we would do it in place of. So,
Well,
surgery is always going to be the best way to get rid of disease, right? Because we know that often, hopefully, if the surgery was successful, we don't leave any cancer cells behind. With radiation, there's a chance for cells to escape, right? Certain cells didn't die and stay there. So there's a higher recurrence rate with radiation. So often we use radiation only after surgery if the surgery was dirty. So if we got our margin back and there were cells there, or we would do radiation instead of surgery. So especially for melanoma in larger ones where we're, a little worried about how much time we're going to get and the potential morbidity of surgery.
So what's the deciding factor between radiation in lieu of surgery? What's aside from financial, because I would imagine surgery is less expensive than radiation. So removing the financial considerations, what's the decision point?
Yeah, so a lot of it is client-based, right? So with surgery in the mouth, we're often talking about removing a portion of the jaw. And that comes along with cosmetic. They don't look in the mirror, so that doesn't really matter that much, but it does come along with some functional effects. Dogs are amazing. And, with these big surgeries, we see them eating the next day. We see them learning how to play. We do still see very high function, but there is a recovery period. It is a big surgery. So for some people, they don't want to put their patient through that, which is completely acceptable. So that's when we would say, hey, radiation's a better choice. And sometimes they're so large that surgery is not a good option for the patient. So we say, hey, we think radiation is going to give us the best outcome as far as maximizing not only quantity, but quality of life, right? So it has to be this really important balance when we're talking about cancer.
Yeah, my second dog that died from cancer was nasal adenocarcinoma, and we took him to CSU, and Dr. Withrow did not want to do surgery, which meant he was not a candidate, not even close for it. So we opted for radiation, and my biggest concern was always that the radiation was going to burn a hole into his mouth that would cause a problem. Do you see radiation effects like that you have to repair?
Yeah, we can. So it depends. It depends how badly the tissue is diseased. So essentially radiation is going to cause almost like a sunburn, right? And so in the mouth, we kind of think about like a really horrible hot pizza burn. And usually that will heal, but sometimes it will lead to a hole. And if there is a communication between the mouth and the nose, we will try to repair them, but radiation really affects the blood supply to the oral cavity. So sometimes we're kind of battling multiple surgeries to try to get those holes to heal. So it's definitely also a deciding factor when we think about, potential complications of radiation in the mouth.
I should have consulted with an oral surgeon back then. It was 2014. No, it was 2010. I'm sorry.
2010.
Yeah, lost in 2011. Because I think the deciding factor was I went with IMRT first, which was 30 days or 4 weeks of slow dose radiation therapy rather than the SRT, I think was the other one at the time, which was the 3 days and the massive dose. I think one of the deciding factors for me, Dr. Goldschimt, was the fear of breaching the oral cavity and managing that along with the cancer. So I would imagine it probably would be a good thing for people that are going through something similar like that to consult with an oral surgeon.
Yeah, I agree. So I think that, normally what we recommend to our clients is kind of get all the information, right? So talk to, an oral surgeon and then talk to an oncologist and kind of get all the information you can to make the best decision for your family.
Right.
Everyone's going to have a little bit of a, different experience or past pets that have been through something that maybe they don't want to go through again. But I think kind of approaching it comparatively is the best option.
Yeah. All right. So that covers oral malignant melanoma. The second one, which I'm assuming is the second most common, is the squamous cell. Let's discuss
Yeah.
that, please.
So squamous cell carcinoma is actually a little bit better, which is great. So squamous cell carcinoma can definitely be locally invasive. That's its biggest problem, is that it's locally invasive and it can spread, but the spread rate is much lower. So, about a 30% risk is the highest that's ever been reported for spreading. It can also spread to the local lymph nodes and lungs. That's where it most commonly would go. But unlike melanoma, it does tend to stall a little bit in the lymph nodes. So even with a lymphatic metastasis, sometimes we can still get it before it goes to the lungs. And spreading to the lungs is the really bad place to go. So with carcinomas, again, surgery would be our standard of care. And with surgery, if we can get clean margins, so, no cells at that cut edge, we can actually get very long-term remission. So in most studies, the median survival time was not reached. So we never use the word curative with cancer. However, we do think that we can get really good outcomes. So even when they're large, that size doesn't matter as much. So even with really big carcinomas, if we can get complete margins, we can still get long-term remission. And they also are extremely radiation responsive. So even in times with kind of incomplete margins, combination of surgery and radiation, we expect them to do quite well. We'll still always watch them for spread, but we feel a lot more optimistic than we would with a melanoma.
That's that's something I always hate to hear, and I never know how to approach it because it just makes me totally uncomfortable when I see I'm on Twitter and social media and I see these pictures of these beautiful fuzzy butts that have gone through chemo, radiation, whatever, and they say my puppy dog, my fuzzy butt is cancer free, thank God. And I just there's the part of me, there's the scientist, there's the hey, there's a part of me that never wants them to sleep well at night because that's the daunting. The fact is the reality is you're not really cancer free, nor can you really ever say you're cancer free. But you don't want to take away from the emotional release and the celebration of the moment. So I'm always torn between those two poles because I think it's important for pet parents to not be relaxed, to know that specter is always there. I did, interestingly enough, recently we had interviewed for Fuzzybutts and Friends a surgical oncologist, and she actually said, and I didn't explore this, but she actually said, what I love about surgical oncology is I can take a tumor out and get great margins, and I'm cancer free. And so I'm assuming there are some types of cancers that if you catch very early and you have, like you said, very clean margins, and it's slow growing cancer, it's a non-recurring cancer, then you can probably say cancer free. But it's a delicate dance for pet parents out there, and I just want to reemphasize during this episode is that for the majority of cases of cancer, you just can't ever feel that they're cancer free. You got to know that that cancer is so complex, and you've got cancer cells always circulating in the blood cells that there aren't really any good diagnostics out there to detect them because they're on the nano level or whatever at a very, very, very small level. So that's all I want to talk about. That I want to bring the great conversation down. Okay, so that's squamous cell carcinoma. Sarcoma. Pardon me. And all right. So for that, and I think I forgot to ask also for melanoma, are there any breeds that are predisposed to either of those two types of oral cancers?
Yeah, we tend to see melanoma a little more in pigmented breeds. So things like chows that naturally have pigment in the oral cavity does seem a little overrepresented in golden retrievers as well. For carcinomas, we don't see a breed predilection. So no breed in particular that we see more of, nor no sex that we see more of. And squamous cell carcinoma in melanoma, we see primarily in older patients. Squamous cell carcinoma, we can actually see in a biphasic presentation. So there is a juvenile carcinoma that we'll see, around 1 to 2 years old. And those actually seem like they might be biologically less aggressive. So one study looked at just carcinomas in these young population, and they didn't reach, none of them had recurrence or metastasis 4 years post-op. So it does seem like we can get really long-term remission for that caveat.
That's a really good outcome, really good
Mhm.
prognosis, much better than most cancers. And we do like the good news when it's something like squamous cell carcinoma. I messed that up a second ago, and what was
That's okay.
carcinoma? It's carcinoma. Just to clarify for the audience. Okay, let's go through the now to the third type of oral cancers, and I can't recall the name of it specifically.
Yeah, so the third most common malignant oral tumor would be the fibrosarcoma. So fibrosarcomas, how kind of when I learned oncology back in the olden days, how it was kind of described to me is it's kind of like the mother-in-law of all tumors. It's very hard to get rid of. It has a very high recurrence rate. So that's the really hardest thing with sarcomas. They have these kind of really long tendrils. So very low spread rate, unlikely to go anywhere, but can be a challenge to control locally. So often we try to do as large of a surgery as we can, so a bigger margin than we would take for some of the other tumor types. However, the oral cavity, that becomes limiting, right? So we always have to think about function and their ability to eat and swallow. And so sometimes that can be the hardest challenge, and they are largely radio resistant. So surgery is really the treatment of choice. For sarcomas, sometimes we will try to combine them with radiation, but we're not sure that it really extends our survival as much as we would like. So normally with fibrosarcoma with surgery, we're looking at about 1.5 to 2 years. However, it's because people are choosing to stop treatment because we're getting recurrence, not because of spread, which is a completely reasonable option at that point. But that's our biggest challenge, is finding ways to make sure that we got all of the sarcoma out at the surgery.
How much of a dog's jaw can you comfortably remove?
Yeah, that's a great question. Let me see. I normally have a skull. I only have a mandible. I don't have the top, but I have the bottom.
Okay.
So actually we can remove a lot. So often we will remove a complete mandibular side. That's called a total mandibulectomy. And surprisingly, they will respond extremely well. And will functionally use the other side. Sometimes we'll also kind of do what's called a bilateral rostral, taking both sides of the front, and we kind of give them a big overbite. Again, they tend to tolerate it very, very well. Every dog is different, but dogs that are good eaters tend to continue to be like, I'm going to figure this out. So it's remarkable how much of the jaw we can reasonably take and then still have a high function. On the top of the jaw, the more we take, unfortunately, the bigger risk of a hole, if our closure breaks down. So we kind of go through all those benefits and risks when we have a cancer consultation. But even if they're really large, sometimes we still have a lot of good surgical options in the mouth.
Ginger had this buddy.
Well, what you were going to say?
Set it up. Let me set
You
it
set
up.
it up.
Yeah, because I love this guy. He was the cutest, most lovable, three-legged. That's actually a 3.5-legged dog from Louisiana named Buddy, and he had oral cancer, and I named him Frankenbuddy. But Ginger, you can tell the story. But he was, I loved him. He was the greatest kid.
There was a tumor in his mouth, but it turned out to be a let me see if I can say this, multilobular osteochondrosarcoma.
Oh, okay, that's not a bad one to have.
MLO. And so we were actually able to do surgery, and I want to say it was like a fourth of his on the left side of his jaw was taken, because at that point it had grown and he wound up losing his eye and part of his jaw. And he had staples. And one of the things, if I thought that he wasn't ever going to survive it, I wouldn't have had it done. But I talked to God and everybody, about his surgery. And so he had staples in this big V. He wound up with a feeding tube. So when I got him back, Luke gave him the nickname of Frankenbuddy, because he was just so, he had all these staples. But, it didn't, when Dr. Mann at the University of Missouri did the surgery, when he talked to me, he was so nice. He says, you know what, I'm going to make him look as good as I possibly can. I said, thank you. I said, but you know what? It's not his face that I love. It's his soul, And so Buddy looked fine after that. He did chew a little funny, but it only took him a couple of days until we started calling him Biscuit Head, because all he wanted to eat was the chicken and biscuits from Chick-fil-A
Oh,
for about a week. That's all he wanted to eat. I'm like, okay, whatever.
But man, Frankenbuddy, he was a beautiful boy. But yeah, missing an eye, part of his jaw, and part of one of his legs.
And he had buckshot in him.
And that's right. Somebody shot. He had buckshot in his fuzzy butt, and but it didn't slow him down at all. Speaking to quality of life, like you were saying, is that he still thought he could catch squirrels, and it didn't affect him at all. And I loved the beautiful Frankenbuddy.
He was a Katrina survivor.
That's right, and he was a Katrina survivor too. And nobody would adopt him except after, like, how many fails did he have? It's like the most miserable story.
Most of them they weren't his fault, like, because he was unstable because of the 3 legs. Somebody adopted him, and he accidentally knocked her 2-year-old child down, and then the child she was afraid of him, so he wound up coming to live with me. So I'm like, okay. I ran the Humane Society at the time, and we all knew he was mine to begin with, but
we always like to interject stories about our Fuzzybutts and Fuzzybutts and friends, but this one ran a little bit long, so I appreciate your patience. All right, so is there anything that pet parents can do to minimize prevention? What are the leading risk factors? Let's go all the way back to the first one, malignant oral melanoma. What is the leading risk factors in that?
So unfortunately, we don't really know for any of them. We don't really have that same data that we have in humans. Like, hey, if we smoke and we drink, carcinoma is more common. We don't know that in dogs. So that's actually one of the things that I'm actively researching. What are we called those driving mutations? And can we kind of link that back to a way that we potentially could prevent this, or find biomarkers to pick it up early, right? So that we could intervene earlier.
Yeah, that's great. Biomarkers, that's what Big Pharma is looking for. And that's exciting research that our foundation funds research as well. And that would be an area of interest that we would like to talk to you offline about, because that's exciting and very interesting. What are your thoughts? Has there been any research at all being done on a correlation between dogs that chew more on grass because of the potential for pesticides and all the chemicals? Have any studies done any correlative links between those?
No, really, no point prevalence studies or risk factor studies have been done at all. Okay. There's some older work that kind of does a study like that in feline carcinoma, kind of looking at environmental factors, but it's not the greatest. And it becomes really hard because we need such a controlled population to truly say, okay, this caused this. So we don't
know if like dogs, if you put Miracle-Gro on your backyard or whatever herbicide on your backyard, that there's an increase in incident. We don't have that data.
No, we don't have that data at all.
Unfortunately, there's a paucity of data in the veterinary oncology. It is a veterinary business as a whole. So we're always struggling for money to fund more and more studies to get more data. Trust me, I feel your pain. You brought up a good point. You brought me back to something I wanted to get to earlier, Dr. Goldschimt, and that is cats. So I'm a dog guy, but I love cats too. And this is Fuzzybutts and friends, all the Fuzzybutts. So talk to us about oral cancer in cats, and maybe even oral dental care in cats.
Yeah, so dental care in cats, and a lot of people forget about them, is actually extremely similar to dogs. They also are very prone to periodontal disease, and we would recommend, frequent kind of professional cleanings and evaluations. Cats also get something called tooth resorption, which is an idiopathic disease where the body actually starts to eat away at the tooth, exposing kind of the sensitive tissues of the tooth, the dentin, the pulp. And often those are only found with x-rays. So another really important reason to be getting those anesthetized evaluations. Cats, as far as cancer, largely get squamous cell carcinoma, and it's more aggressive than it is in dogs. So what becomes really challenging is the standard of care, like we talked about in dogs, is surgery. Cats often don't tolerate those large surgeries. We also have a lot less room, right? A centimeter around a tumor in a cat is a much bigger deal than in a Great Pyrenees. So often we're limited in our treatment options, and they're largely chemo and radiation resistant for some reason. So we really struggle to get control of it. So it's a huge area of research of everyone trying to say, what are better therapeutic options for feline carcinoma, because we're just not really able to offer anything right now for long-term remission if they're no longer surgical.
Yeah, that's the reason why we don't, all kidding aside, why we don't tend to talk about cats as much of our canine companions when we're discussing cancers, because they're just not as good of a model. They don't get a lot of the same stuff that we get. And if they do, some of it acts differently than it does in people. So, all right, is there anything else that you would like to mention to our audience about, just in general, as kind of a final thoughts in oral cancer in dogs?
Yeah, I mean, I think the biggest thing is kind of like we talked about, is trying to catch it early. And, just like us at the doctor, being a self-advocate for your pet. Hey, I saw this, I'm concerned about it. Let's get a biopsy. I think a lot of times people kind of brush it off, or they'll use the term, oh, that's just an epulis, or that's just a little gum nodule. But sometimes that's when we could have caught it and had really great outcomes. So being proactive with your oral exams, and then not forgetting that in a lot of these, we can still get long-term remission, and they can tolerate these surgeries really well. So just getting that information, from an oncologist or an oral surgeon to talk about what that would look like, I think can really make a difference.
Yeah, I want to underscore that, put some stars around it, and put a couple of exclamation points on it as well. Biopsies, because that makes the difference, all the difference between you've got something that is surgically resolvable or something that's a lot more complicated. And we talk a lot about lumps and bumps, and a biopsy is not that expensive, and it will tell you everything you need to know. And more importantly, one thing that I also want to reiterate is that the oral cancers that we're talking about, have outcomes, prognoses that are generally better than all the other cancers that we typically talk about here on the show. Lymphoma, which is typically less than 2 years, bone cancer, less than 2 years, hemangio, I can't recall what hemangio is, but so you think about, if you don't biopsy early or know what you're dealing with, or you could have another 2 potentially more years with your fuzzy butt. And as we know, 3 more years out of a fuzzy butt that lives 15 years, that's 1/5 of their life, or whatever that number is. And I don't know anybody that wouldn't give everything an additional couple $100 to live, a fifth more, 20 more years of your life. So biopsy, have it biopsied. And then, pending the results, consult with a veterinary oncologist, board certified. I also have to reemphasize that, because that makes a difference in the decisions that are made, the medical decisions that are made on behalf of the Fuzzybutts. All right, just a wealth of information, Dr. Goldschimt, just a ton of information. You presented so brilliantly. I wanted to talk about, as we wrap things up, what do you do for pet parent education?
Oh, that's great. So there is a good amount of information on the AVDC website. So that's the American Veterinary Dental College. So that's kind of the umbrella that I fall under. And then I think that, there is we could do a better job, I think, as a community at getting education out. So I think things like podcasts like this, or even, having groups like you reach out and saying, hey, we need a informational, podcast or video about cancer. And having someone make that is the best way to go about it. But we normally do most of our education case-based, which you're right, I think we could probably do better. Excellent.
Well, yeah, educating the pet parents makes all the difference when they're making treatment decisions. And it's just, we have, as you know, and I want to ask about that in a moment, we have so many better tools in veterinary medicine than we did 10 years ago. And if pet parents aren't using them, if only 10% of them are using them, or 20%, we're just not doing enough repeating the message and educating them and raising awareness. So that's something we try to do strongly here with Puppy Up, the foundation. Also, kind of a thought here, Ginger, you should kind of get together, maybe UC Davis, maybe Dr. Goldschimt might actually have some leaflets to put in the swag bags at our Puppy Up walks, because that's one way that we disseminate information to our all the wonderful people that support our foundation and go out and do the Puppy Up walks.
And that's what I had just written a note about that, and to see if there's anything on maybe that website that we can share on our website as well.
Okay.
In our newsletter. So I'll connect with you. to see where you can show me a path, show me the way.
See, I beat you too. That's why you're the junior co-producer. That's
Yeah, well,
for that.
you saw me writing it down. I know.
Yeah. Also, make sure that you get the links that you're talking about to the websites, and we'll put those in our show notes as well. Okay, as we wrap things up, that was a great final message about cancer, and our canine companions, our fuzzy butts. Is there any other final message you have for pet parents, generally about oral care?
Yeah, I think it's just don't overlook it. I think people really don't think about it till their pets are so much older. Then we're dealing with these surgeries where you have 30 extractions, like horrible gum disease. And if we start early and we focus on prevention, I think that's the best thing we can do. And even if you can't brush, that doesn't mean that, it's like a losing game, right? Even if they're a Chihuahua, if you can focus on frequent professional cleanings and doing things like dental treats, dental diets, we can still have really good oral health.
Excellent. I did skip over one final thing I wanted to go over and just ask you real quick. I think we have time. Is about UC Davis. It's a wonderful institution there. I've been there. I visited it on my second and my West Coast walk. And so, you teach as well?
Yeah. So I'm about 50% on clinics in the hospital, and then 50% teaching and research. So we teach a core course to the second and third year vet students, and then we have fourth year vet students who come through rotation as well. And then we have 4 residents.
That's wonderful. I mean, it's a trifecta. You're a clinician. You actually treat the fuzzy butts and meet the pet parents and help on that side. And then you educate future veterinarians, and then you do research, which is critical to our common knowledge base. So, all right. I think that wraps everything up for this episode. Before I go, Ginger, we usually do a cancer tip of the week, sponsored by the Puppy Up Foundation, but I think we've had about 300 cancer tips this week. So we'll skip that this time. Ginger, did I screw anything up this time, this episode, like I do every other?
I don't think so.
All right, covered everything.
I think you covered everything.
All right, everybody. Well, this episode, we'll look forward to it. New episodes come out every Tuesday on your podcast platforms such as Spotify and iHeartRadio. As well, you can go to our YouTube channel, which is fuzzybuttsstudios.com. You can watch it. You can see our wonderful audience, our guest, and then my junior co-producer. It's worth the show sometimes to get to know who you're talking to or listening to. All right, I think that's it for this episode. So we'll see you next time. Puppy up. Talk soon.
Thank you.
Bye.
Bye.